Well, I'm joined now by Mads Gilbert. He's a medical doctor and activist, and he's also worked in the Al-Shifa Hospital. He joins me now from Cairo. Doctor, thank you for joining us again on Al Jazeera. I understand you are currently in touch with colleagues. Can you tell us what the situation at Al-Shifa is like now? We knew the blackout was coming, but not necessarily the strikes or the snipers.
Well, I think there are two aspects now important to understand. Number one, they are surrounded by Israeli armed forces who are shooting at the hospital. We learned this morning snipers were shooting through the windows and into the staff. We also learned that one nurse was killed in the neonatal ICU. Now they have, I just got received a message from Dr. Marwan Abu Sada, who is one of the senior surgeons, and he says 38 neonates moved now to cardiac surgery unit in main operating theater in open space, not more in incubators, because oxygen generator was damaged by fire strikes yesterday. No electricity. About 600 inpatients, 28 ICU adults, 2 of them in ventilators. They are in the emergency room. And I got this picture of the babies who should have been in the incubator. They are now lying on the floor in the cardiac unit, and they are covered with some blankets in order to avoid hypothermia. These babies should have been, they should have been in the incubators, of course, and they risk death. 3 of the neonates are dead, and there are 39 now lying on the floor with blankets around who are at high risk of death. So this is it's not a difficult situation, it's a horrible situation. And of course, this points to this humanitarian total failure. And I'd like to underline one point more. Now we talk about the fire and the attacks on the hospitals, and we need to discuss that and stop that. But we have to understand that most of the most serious problem now is 1.5 million internally displaced without water and food. People are desperate, and you can't live long without water. They're even taking water up from the streets, and they're drinking seawater with sugar in. So this is a massive failure of the international humanitarian society, who should have been there with water. It's getting colder in Gaza now. They sleep under open air. They don't have blankets for the children. 1.5 million civilian Palestinians out in the open with no water and no food. And the attacks on the hospital. Now, the struggle or the fighting goes on in the north. There is no possibility, they tell me, to access the wounded or the dead. So we will not have updated numbers on the killed. And I get a flashback to the Sabra and Shatila massacre, which was done in complete darkness for 3 days. And I wonder, where are the journalists? I haven't heard from the Al Jazeera journalist in the north for many days. And I'm very fearful that there is an ongoing massacre which will not be covered, and we will not be able to see it. But in Al-Shifa, desperate situation, no oxygen, no food, no water, and of course, absolutely no security for patients and staff.
Doctor, when you and I last spoke just a day or so ago, you were telling me that when you've been there, when you worked there for 16 years, you saw no Hamas military operations anywhere near the hospital facility. What do you make of Israel's claims now, its operations around the facility now?
I have to be honest with you. I'm sick and tired of these claims that there is a Hamas command center. We, as I've said 100 times, we have never seen it. We have never seen any high-ranking Hamas people in Shifa. We've been able to roam freely all around. I've never seen anything, nor have my international colleagues. I don't think the Israeli army has any moral standard, because the playbook of war, the Geneva Convention and the Hague Convention, clearly states that hospitals are protected objects, even if there should be some military personnel. So these are the claims, and they don't even need these claims, because they have bombed Rantisi, they've bombed Nasser Hospital, they've bombed the Ahli Arab Hospital without any claims of any command center. So they seem to be attacking healthcare as a part of their strategy. And we know that from 16 years. They've always been attacking healthcare.
Doctor, what do you understand about the restrictions on movement around Al-Shifa at the moment? Our correspondent earlier was saying that doctors can't even move from department to department. Why restrict people from moving within the facility? Why shoot through windows?
I think you should ask that question to the Israeli military officers and the chief of staff and Mr. Netanyahu. And most of all, you should ask President Joe Biden. Why are your troops on the ground, supported by the United States, shooting and killing health personnel in the hospital when they try to save lives? I'm not the one who should answer that question. It's actually the Israelis, because they are the perpetrators. And also, I think it's prudent to ask, why are you not allowing water and food in? Is this a genocide in slow motion? The answer is yes. And I think the responsibility, the complicity rests on the shoulders of the American politicians and the president, and on the European politicians and their leadership, who are whispering some small protest. This has been going on for 4 weeks now. People are dying hour by hour. People are starving. People are thirsting in 2023. When is this going to stop?
Dr. Mads Gilbert, a medical doctor and activist who's also worked in Al-Shifa Hospital.